I typically don't like to operate on them when their pressures are in the 40s or 50s. And you want to bring it down to a safer level, say in the 20s or 30s, right? The micropulse laser is a good treatment. The Cyclo G6 device is versatile. It's supposed to be more gentle, creates less inflammation, and therefore results in a safer procedure.
We're here at the Topcon booth checking out a really unique piece of tech that's flown under the radar in glaucoma treatment, micropulse transscleral laser therapy, or MPTLT, and the Cyclo G6 device with micropulse 3 probe from Iridex. Joining us to take a closer look at the science undergirding this therapy is Dr. Victor Ko, the head for the Department of Ophthalmology at the National University Hospital in Singapore. Thanks for coming on the show, Dr. Ko.
Thank you very much.
So you talked a lot about the sclera. Let's talk about transscleral laser therapy. There's a lot of people out there that might not be familiar with this. What's the mechanism of action there?
When we talk about transscleral laser therapy, there are two main forms. The continuous wave laser. These are lasers that reduce aqueous production. It is more destructive, has more side effects. One of this innovation that we are now getting more and more comfortable with is the micropulse version of transscleral laser. It's supposed to be cold laser. It's supposed to be something that's not destructive. So it has this interpulse of rest and active laser. So it allows the tissue to cool down and not heat up to boiling temperature. It's supposed to be more gentle, creates less inflammation, and therefore results in a safer procedure.
Are there any cases where there is a patient who is definitely a candidate for surgical intervention where you're like, hey, wait, maybe I should use laser?
If a patient has high eye pressure, and I typically don't quite like to operate on them when their pressures are in the 40s or 50s, right? And you want to bring it down to a safer level, say in the 20s or 30s, right? The micropulse laser is a good treatment. You do that, you wait for about 2 to 4 weeks, and then when the pressure is lower, you go in, the surgery becomes safer. Now, the second scenario, which is quite common, is if someone presents with high pressures in both eyes, then you want to operate for one of the eye with higher pressure. So what we do is, on the same setting, micropulse laser on one of the other eye and do surgery in the eye with higher pressure. After operation, both eyes have nice pressure. You buy some time for the other eye before you go in for the bigger surgery in the other eye. So that's common indications that I use laser for.
We talked about indications now, and we talked about selecting patients. I want to talk about the data on this therapy. Are you familiar with the research on this?
In Singapore, in National University Hospital, we do have a long history with the micropulse, right? It is where it originates in the first place. Our center has published our mid and long-term data. The first take-home message is that it is safe. Hardly any complications. We have not seen eyes that has ptysis or severe inflammation. The long-term efficacy of the treatment is something where more research needs to be done. In the midterm, at the very minimum, I can tell you it is effective. It is repeatable, so that's another big advantage of micropulse laser. You can repeat the laser, and patients do get additional benefits from repeated lasers.
So let's move on now to talk about the device, the equipment that we use. Let's talk about the Cyclo G6. Have you ever used this device in your practice?
We're very familiar with the Cyclo G6.
Yeah, so tell us about your experience with it.
The Cyclo G6 device is versatile. I remember during COVID period, we used that quite a fair bit because patients can't quite come back for their follow-ups. You don't know when they get COVID. So it is, in a way, a safe and versatile device. Because of innovation and new probes, these are easier to use, more comfortable, and with appropriate change of the settings and training, can become more effective as well.
Yeah, so you mentioned the probe, the MP3 probe. Let's talk a little bit about the micropulse 3 probe. Do you like it? Have you used it? I mean, what's your feedback on this device?
We are currently using the version 2. I think most people would recognize it as bunny ears, the one with the bunny ears. And the bunny ears is the part that you have to align with the limbus, right? So I think that makes compared to version 1, makes it a lot easier to apply, especially in Asian eyes. Right? I tell you, in Asian eyes where the pupil aperture is smaller, it can be quite tough, to apply a probe that's so big. So the design of the version 2 is optimized for smaller eyes. It's not just in Asia. You have you have inflamed eyes, swollen eyelids. It helps a lot when the design of the probe allows easier application, easier movement. So I think that's a good piece of innovation that Iridex have created.
What other features of the Cyclo G6 do you really find helpful to you when you're performing the procedure?
Relatively simple. You don't need a lot of equipment. The truth is, you just need light and the laser probe. You don't need lenses, you don't need a microscope. You don't even need the patient to cooperate with you that much. As long as the patient is relatively still, you could perform the laser. It's fast, right? It doesn't take up a lot of your time. And we are now doing it increasingly in the office instead of bringing the patient to the OR. So I think that's the beauty of this procedure.
Yeah, so I mean, it sounds like there's definitely a lot to love about MPTLT and the Cyclo G6. So for a lot of doctors out there who are kind of looking at this, thinking about it, what would you say to them?
I think with anything new, there will always be some resistance. Patient selection is very important. Having someone who is familiar with the procedure to take you through the procedure will be helpful. You don't want to choose a patient that's hard to perform the procedure, right? So I think my take home for that will be patient selection.
So let's say you've got the device and you have a doctor who's looking for a more experienced surgeon like you. What are some pearls of wisdom you can pass on to them? Maybe device specific or things that really help you, just some tips and tricks for the device.
All right, there's several things which I tell my fellows will be helpful when you use this device. If the palpable aperture is really small and you can't quite have the probe in, you could remove the speculum. Right, in someone who is relaxed, the speculum can come out and you can apply the probe in an easier manner. I know that the training manual says go in hemisphere, right? That means you do half by half, but I find that it is easier to go by quadrants, and that gives you more control. So I think for beginners, I would say that is important. Now, one last thing which I would like to highlight is the importance of the coupling medium, right? You really need to use either a gel or some fluid that couples the laser to the conjunctiva. Now, this allows a lot better energy transmission, and you find that the effect of the laser is better with a coupling agent. So those are my tips.
So do you think that MP-TLT should be a part of surgeons' repertoire here when they're considering treatments for glaucoma?
I think it will be a very helpful tool to have. You know, glaucoma is a complex condition, different stages, and the patients themselves have different preference as well. It is important to have a range of treatment which is acceptable to the patient, and the MicroPulse fills a space in which incisional surgery is not there yet.
Perfect. Well, Dr. Koh, thanks so much for coming by and sharing all this MP-TLT with us. It's been really, really interesting.
Thank you very much for your time.
And for all of you out there who are looking to know more about this, check out the Iridex and Topcon website for more information. Thanks for joining us and take care.